Okay, welcome everyone. I'm Michelle Jeffers with San Francisco Public Library. Um, I think I would be remiss right now if I didn't acknowledge the painful situation we are in as a country. San Francisco Public Library stands in solidarity with all who are working toward collective action to end systemic racism and inequity in our country. We are carrying on today because one of the ways that the library can help our community is to provide useful and factual information. So here we go with our program. The library is thrilled to welcome back geriatrician and author Louise Aronson. She gave a standing room only talk in our Coretta Auditorium in January, back when we had in-person live events. Her book, Elderhood, Redefining Aging, Transforming Medicine, Reimagining Life, is a finalist for this year's Pulitzer Prize in nonfiction. You've probably seen her more recently on NPR, and in the Atlantic, Vox, and the New York Times, calling out the ageism endemic in much of the pandemic coverage and policies. For this talk today, we had almost 100 questions submitted for the forum. So we've grouped them by general topic, and we will try to cover as much as we can over the next hour. We'll do our best to cover the topics raised today, answering questions submitted ahead of time first, and then covering the questions that are raised in the YouTube chat near the end of our program. Dr. Aronson, thank you so much for being with us today. I'd like to start off with a framing question of what your personal and professional experience of the COVID-19 pandemic has been, and then get into the questions that have been submitted.
Okay, well, it's a pleasure to be here. I think, as I said at the live event, I spent much of my childhood going to my local public library and still lurk in the hallways of various public libraries in the city. So it's great to be here. Although, of course, we're here virtually because COVID has changed everyone's lives. I think I have been fortunate in many ways. I have I have a home, which in San Francisco is saying more and more these days. And I have work, which is also saying a lot. I was sick in March before we could get tested, so I still don't know whether I had it. I'm inclined to believe it was a cold. It really wasn't that awful, but who knows? At some point I'll get an antibody test. But mostly I've been incredibly busy because there's all the usual work, turning clinic and teaching over to video. Then I've been volunteering or working with the mobilization of the San Francisco Department of Public Health, and of course writing about COVID, which has hugely disproportionately affected older people. And while we've seen more attention than previously, we actually haven't seen attention proportional to the damage the virus has done to older lives.
Well, that's a good way to lead into some of our first questions, which again were submitted earlier, such as age as a risk factor and age in conjunction with other risk factors. So we have people who are writing in, they're 82, they're fortunate, they have no other underlying conditions, they have a healthy, balanced diet, they exercise regularly, but are they still especially vulnerable to the virus just because of their age? And is the risk different the older you get? Is it different for 60-year-olds, 70-year-olds, 80-year-olds, et cetera?
Such good questions. It's good to be healthy at every single age, right? That not only it makes it less likely you will get certain conditions, but if you do get them, your body is stronger at fighting them. So good nutrition and exercise, always helpful. There's not an upper age limit on that, although I will admit that if we're going to be strictly scientific, the best studies only go through age 99. It is, however, to believe that something that's good for you at 99 wouldn't be good for you at 100 or 105. So we hear a lot about risk factors, age versus other things. So we know there are risk factors including heart disease, lung disease, diabetes, severe obesity, so generally with a body mass index over 40. But it is a risk factor. So your risk, if you have one of those conditions as well, is going to be higher. So age is a risk factor for the diseases I just mentioned, for at least diabetes, heart disease, cancer, et cetera. So that poses you some risk, but actually age alone is a risk factor for a variety of reasons. Most changes to systems as we get older. So there is a phenomenon called immunosenescence, which is basically the age-related changes in immune system. How our bodies attack the virus, they're sort of like a 1-2 punch. And the first punch, the lymphocytes do okay. But the second part, the T cells, do not do what we need them to do. There are a variety of ways. It's sort of complex science here, so I'm trying to figure out a clear way of saying it. But basically, they respond more slowly. There are fewer of them in the right categories. Um, they actually don't get presented with the virus the way they should, and then their communication with B cells that produce antibodies is different too. So there's just a whole cascade of ways in which an older immune system is different, which means that age alone is a risk factor. The risk does vary across older age groups. So if we take the legal older age, for COVID, it seems to be 60, but legally it's been 65. So if we're in that neighborhood, actually we need to start for that. The risk starts going up for people in their 60s. And then from the 60s to the 70s, it goes up pretty significantly. And the highest risk group by far is people age 80 and older. And this is all because of these age-related, and also because the longer we live, the more likely we all are to develop some of the other diseases. There's a final factor, which is if you do get sick, your lungs don't have the same elasticity or ability to sort of compensate, nor do your other organs. So if you get really sick, it's just harder for you to fight that and then also to fight all the sequela of being that sick. So the bottom line is it's very good to be healthy at 82, and there's still some increased risk. I am sorry.
It's frightening. It's frightening for everybody out there. I think that we've seen some news coverage too about race and gender as well, perhaps not as being a risk factor for this. Could you address that a little bit?
Right. So yes, so 8 out of 10 deaths are in older people, but a hugely disproportionate share of deaths are also in brown and black skinned people. Now, as far as we know so far, this has less to do with biology and more to do with culture. So if people are saying that the current uprisings and anger aren't related to the pandemic, I think this is one of the ways in which they are. Because we have fewer opportunities as a society for people of color. They're more likely to live in crowded close quarters because of poverty, to have jobs that are essential worker jobs, to have to take public transit to those jobs. So we have basically socially constructed higher risk for people of color. And that is clearly true in San Francisco, for example. A huge proportion of sick people and deaths have been in Latinx people. Among older adults, it's been disproportionately Asians. So we're seeing different patterns for different reasons in different age groups and at different hospitals. In terms of gender, the story is pretty interesting too. I guess interesting probably isn't my best word choice there. But men are clearly at higher risk, both for getting sick and for dying. If you look at the San Francisco statistics, about 60% of cases are in men and 65+% of deaths are in men. It's not entirely clear why this is. Men's health in old age tends to be worse for a variety of reasons. I actually discussed this last fall in the New York Times. So I won't go into all the general reasons, but among the specific reasons for COVID, there is some biology which might be related because these cells called natural killer cells can prompt an inflammatory response, and there seem to be gender-based differences in how these natural killer cells age. And so if you have a huge inflammatory response, you actually get sicker. And if that response continues longer, you're sicker still and more likely to have some of the overwhelming organ system damage that we're seeing with this virus. There are always comments about some sociocultural aspects of this. So for any men and people who love men who are listening, so I'm assuming for all of us, this is relevant information. it's really important if you're sick to get help. And, we teach men to sort of man up and, I, like most people, have been in situations when that is a wonderful thing. This is not one of those situations. This is like, if you're having trouble breathing, you need to go to the hospital, because the sooner we can get you treated, hopefully the better your outcome.
Great advice, Dr. Aronson. Thank you. All right, let's go on to age and symptoms. Are symptoms of COVID infection different than the standard fever, dry cough, difficulty breathing? Let's see, has the evidence thus far indicated that seniors are far less likely to have truly asymptomatic cases of COVID-19? And does having an asymptomatic case mean that person has no damage whatsoever to their body other than the presence of the virus? I think people are afraid that, again, that we're all might be carrying this virus around, but maybe seniors are really showing the virus and not having the asymptomatic cases. I think that's sort of the point of that question.
Okay. Well, maybe I'll start with the first one, which is, do older adults show the same symptoms? Most do. So, the fever, the shortness of breath, the dry cough, the muscle aches, the sometimes the intestinal disturbances, the sudden loss of smell or taste. But with increasing age, and also perhaps particularly with increasing frailty, we have seen a variety of other symptoms. These are really common in older people across a range of problems. So from broken bones to having heart attacks to having other sorts of infections. These are called atypical symptoms because we have made adults the norm. In older adults, especially in frail, much older adults, these can be fairly typical. And they include confusion, falls, loss of appetite, and generally there's this sort of strange term we use in medicine called failure to thrive. So, some people, when they hear this, they think, well, aren't all older people confused? Well, no, actually, most older people are not confused. And clearly that some people have dementia, so exhibit some confusion. And so the important thing here is that it would be new. It would be a change from the person's usual behavior. A person who doesn't fall that starts falling, also suspicious. There are many reasons for this. But the sort of good news, bad news is it might be COVID, but clearly there's something going on that requires medical attention. So seeking medical attention makes sense with those symptoms. Now, just to sort of move slightly to the ageism focus, this has been known. In China, these atypical symptoms were noted in January and February. We had data from Italy in February that they were present. And my geriatrician colleagues across the United States were noting these so-called atypical symptoms in March. The CDC has only included one of them in its guidance at this point and not on all pages. And that's confusion, and that only happened in mid-May. So the site both says that 8 out of 10 people who are dying are, but they didn't put up a page for older adults until well into the pandemic, and they didn't add confusion until last month. Sorry, haven't moved to June yet mentally. So ageism is clearly part of the national response. In terms of being asymptomatic, we don't have a ton of data on this. It is less likely based on how we see other groups, other diseases among older adults, but we do know it's possible. There is one study in the New England Journal of Medicine looking at a nursing home in Washington state. And they did testing once they'd had some first cases, and they found about half the people they tested were asymptomatic, but it turned out they weren't all asymptomatic. A plurality of those, not all, but over half of that half, were what we call pre-symptomatic, which meant that in the next week or two, they developed symptoms. The last part of that question was, could it be doing organ damage if you're not having symptoms? Really unlikely, because organ damage is not comfortable, so you would probably have symptoms. So really unlikely. But if I'm going to be strictly scientific, I guess I'd have to say we don't know, but I really think it's unlikely.
I hope that gives some comfort a little bit to people too, who are worried that they may be carrying it and damaging their body and not being aware and not, so of course the shelter in place is in place. with the different tests, I
Right.
mean,
Well, I guess we should hope that I was going to say that, hopefully if you did have it and you have antibodies and you didn't feel anything, that now you're actually protected and it's not doing any harm. So finding out you have antibodies could be good news.
speaking of antibodies, maybe you could talk about the different tests that are out there. There's, of course, the test that you have an active infection versus the antibody test. And what would you recommend? I know there's been test shortages and things, but what would you recommend that people get tested, whether for the active infection, for the antibodies, both, either?
Well, there's sort of the ideal world scenario and then the world in which we live scenario. So in an ideal world scenario, we would have a national response. We would have scaled up testing, converted factories that make other sorts of things to make tests. And we should also say that there are some 86 or more tests and only 4 of them are FDA approved because of accelerated pushing. So you don't know, like, which test are you getting? Is this a true, negative, or is it a false negative? That adds to stress. But we don't have adequate testing now. You may have noted that the mayor declared in the beginning of May that all skilled nursing facility residents should be tested every 2 weeks in San Francisco. Well, it took most of May to get through one testing series, and now, and people are coming off the crisis. So it's really hard to do. For people who can get themselves to testing, there are available city locations for testing. The antibody test is helpful in knowing whether you've had the virus and maybe were an asymptomatic carrier. That's maybe even harder to get. So in an ideal world, we'd actually, especially since we're expecting maybe resurgence, partly based on behavior and based on seasonality of viruses, it would be nice to know how many people were sick right now, how many people had been exposed, what the real percentage of symptomatic is. And for that reason, people who can get tested and can get to one of these centers, it's probably a good idea, if only to inform us of what's going on in our community at present. But we still just don't have any national leadership in terms of ramping up testing or distributing it most fashion.
So I think that's the big issue. I think I've frozen a little bit with you, Louise. Maybe you're still there. But I think the testing is critical. It sounds like you're saying.
Can you hear me now?
Gotcha.
Okay, I'm back. Okay, good. Yes. 2 types of testing, both important, neither as available as they should be, but if you can get something, if you've been feeling great and best thing is not, you're being cautious, then get tested. Yeah.
Just going into what you just said, there was a question that came in on the chat, which is, it's not clear if a positive antibody test indicates protection from further infection.
Right. So our best guess right now is that it does offer some, at least near-term protection. How enduring that is and how complete that is, we don't know, but it's looking like it's offering some protection. Really, this is also new, and generally you want studies to last months or years. So it's just hard to say. But as a general rule, having antibodies is good. It appears that that's going to hold at least somewhat in this case, but we don't know yet.
Similarly, the thinking is that if you have had the virus, you're unlikely to get it again, but do we know that for sure?
We don't, yeah. So that's related. It would be whether your antibodies were fighting off infection should you become exposed again. And we don't know. It probably offers some protection. Countries actually, because we're behind some countries on this, it will be interesting to see what happens, but they're having sort of these COVID passports, you have antibodies. So maybe you can go out to work, or you can do a variety of other things. I think we'll find out in the coming months. We are hopeful, but we're not certain.
Okay, thank you. And now many people asked about age and treatment, and people, of course, are very concerned about the treatments and what those mean. So for example, Patricia asks, is intubation on a ventilator more likely to fail or permanently disable an older person than a younger one? Let's ask that.
Okay. Yes. An older body has sort of less resilience, I guess, fewer reserves, basically. If you think of, this isn't entirely biologically accurate, but if you think of, if you're born completely healthy, you have a certain amount of capacity in all your organs. And even if you don't get sick throughout your life, you're using some of that. You have, think of it in terms of money, you've been spending along the way, so you at the end. So there is less resilience each organ. We talked about the lungs earlier losing their elasticity, and there are similar changes in all other organs. So any physiologic stress is harder on an older body. Which means, and we know this from other sorts of hospitalizations, that people recover all the time. It happens a little more slowly. It is a bit less likely, but it's not unlikely. And I think it's important to emphasize how important it is working to get back your ability is. I think many clinicians, and actually we have studies to show this, that a lot of clinicians assume, oh, this older person got sick and now they're more frail. That's a shame, but there's not much we can do. Well, there's data that for a lot of people, really getting back to exercising and good nutrition, pushing hard in rehabilitation makes a huge difference at every single age. So don't let people tell you, well, that's good enough now. It also happens slowly. So you really have to give it the better part of a year before you can expect to be back to normal. It depends also how sick you were. If you were just sick for a few days, come back in a couple weeks. For a few weeks, it was longer. Intubation has lots of risks, and we do know from all the countries involved that once a person, particularly a person over age 80, gets intubated, the chances of survival go way down. Different studies have shown anywhere from 45 to 90% death rates in that situation. And we don't know a lot yet about lives and bodies like after that degree of trauma. We don't even know that particularly well for young people, though we're hearing from sorts of people that it's pretty hard for a long time. That said, we talk about how horrible it is in people over age 80, for example, but most death rates are somewhere, in the 14 to 15% rate. So that means 85% of people are not dying. So the risk is significant, but it's a foregone conclusion. It is, however, you are, however, much more likely to die if you're over and end up in the hospital, and especially if you're over age 80 and end up intubated. You can decide, however, that you don't want to go that route because of the huge risk that won't work, and quality of life after. And many people are deciding that, who feel like they've had long, good lives. Now, the vast majority of these people, it's never going to come to that. And that's a wonderful thing. But there are advanced directives. There's a good site called Prepare for Your Care that I recommend, where you can focus just on COVID or focus more generally and really think about what matters to you as a unique individual human being, and what are you willing to put up with, and what do you absolutely not want. These are good conversations for all of us to have as soon as we reach adulthood. And certainly if you're in older age groups, the time is now.
All right, thank you, Dr. Aronson. And I have some chats here asking us I'll try to stop speaking so quickly, but both of us to slow down a little bit for our audience.
Apologies. Yes, we were trying to fit a lot into a short period of time also. So sorry, we're both guilty.
I know that I'm a fast talker, and I'm going to try to pace my words. So you talked about that's the site prepare. Can you repeat the language, the name of the site that you
prepare for your care.
Prepare for your care, and maybe we can put that a link to that in the chat field as well. But
yeah, it's there in several languages too. I'm not actually up to date on which ones, but several of the most common ones in San Francisco, certainly.
Somebody's asking a chat question before I go a little bit further, because it seems a little bit on topic, who says, at my age, the risk of infirmities and death seems much greater than getting COVID-19. Why should I give up months or years to the shelter-in-place orders?
Yes, I agree. I've been thinking a lot about this, and I have an article in the queue at the Times coming out on this, because I think, you know, and this is actually common with people in public health and medicine thinking about people and their lives, who put, and actually adult children tend to do this too. They tend to prioritize safety at the top of the list. But when you actually speak to older people, safety is up there, usually at the very top. There's something to be said for quality of life, for meaningful activities. I was really heartened to see the new mandate that everyone should wear masks, because as I'm sure those of you who've been out have seen in the last month, there was a huge erosion in mask wearing. Yes, you have mine back here too. Here we go. Huge erosion in mask wearing. And I feel like some people are still unclear on why you wear the mask. A lot of the people I was seeing who were maskless were people in their 20s and 30s, generally white people. Yes, they are at lower risk for getting really sick from this, but we don't wear masks we wear masks to protect the people around us, the masks that are widely available. If you have something like an N95 or even certain other multi-layer masks, that's the wearer too, but it's really about being a good citizen, a good neighbor, a good friend to wear your mask. So if everybody complies, that will lower the risk. If we do the social distancing, people should be able to get out and about. If we're careful in pods that people select to interact with, so the slightly larger than your household groupings, which are actually not legal yet in San Francisco, according to this week's public health ordinance, but which is being experimented with elsewhere. And informally, one is hearing of this in San Francisco too, so it seemed worth mentioning. I think, you know, you have to weigh for yourself. And another challenge I have with this safety only approach, I think, you know, having safety in your top 3 isn't a bad thing, but I think safety only erodes mental health, physical health, and quality of life. And particularly if you are much older and the horizon of your remaining life is short, then having 6 months when you're sheltering in place or 2 years is a colossal percentage of the whole. And I don't feel like those things have really been taken into adequate account by the people making these directives. It also is sort of stripping people, this is one of my other popular refrains, it is stripping older people of their agency, right? We're giving people who are adults greater choice about what they do with their lives, and older people less choice. And I think none of us of any age should be allowed to behave irresponsibly. Well, okay, maybe if you're 4, you can do what you want. But the rest of us, the adults and elders, should be behaving responsibly towards everyone else, and then making judgments that, as long as they don't endanger others, might enable us to safely do more things that give life structure and meaning and purpose and pleasure, because that matters, and it's already been several months.
Right, thank you for that. I see a lot of questions are coming in about sheltering in place and what is safe. So let's move on to activities. One of the questions came in is, how best is it for someone in their 80s or 90s to shelter in place? And if they're already have a pre-existing condition, should their whole household also be sheltering in place with them? Let's start there.
Okay, and I have just received a message from the tech support. I usually have no internet problems, but as I mentioned before we went on, it's been a problem today. So they asked me to stop my video temporarily and see if that helps our audio. So I'm going to do that. I'm also realizing that we're not actually speaking very slowly at all. So the question was about older people interacting with family members while sheltering in place. Sorry, I was doing two things at once. So
should they be more careful? The older they get, should older and older be sheltering in place more than a younger senior, I think.
Well, yeah, so this is another problem in that we lump all older adults in one category, even though, as I said, it really, as you move through the decades of old age, and old age is currently a 20 to 50 year experience, depending on who you are, your risk of having other diseases and your risk of getting very sick from COVID and having trouble getting better goes up. So risk is not created equally. There are also lots of people in their 60s, 70s, and increasingly in their 80s who are working. Do those people go back to work? I had this discussion last week with one of my colleagues who's in his early 70s. So again, we don't know the right answers. We know what's absolutely the safest, which is to shelter away. But again, you have to balance safety and having a meaningful life. So I think, trying to, if you're going to be with people, be outside if you can, to have a good amount of space between you and the others helps. But this leads to other problems. People who never have any physical touch aren't as healthy either, right? If you can't get a hug from your family members, how long does that go on for? Hugs release all sorts of happy, healthy hormones in our bodies, if they are desired, obviously. So there isn't a right answer, but I would say all precautions and balance the risks and benefits for you, but it does tend to go up the older you are and the more of these so-called comorbidities you have.
All right. I know that everybody has been looking forward to June as we have seen the, easing of restrictions here in San Francisco, some retail spaces opening up. But the question is, as the rest of society sort of tries to get back to normal, starts going out more, visiting stores, visiting places, in stage 2, I think it's stage 2 and 3 is how the city is identifying these stages. Should seniors still hold back? Is that something that maybe they should fall back a stage behind everybody else?
Okay, I'm going to come back to answer. I wasn't sure. Did you feel that was helping? I wasn't sure it was on the delay. Well, the guidelines say that seniors should be slower to return to usual life because of increased risk. And so in the staged approach, they come very late. And this is being replicated all through society. In my clinic, for example, every 2 weeks we're increasing who's in clinic, and so geriatrics and the cancer docs are coming last because the people we tend to treat are at highest risk, and that's sort of what's happening on the social level too. It probably depends, and this is where our national response also fits in, because if you had enough PPE, there was actually a great article by Sid Mukherjee in the New Yorker last month about what other countries have done to ramp up needed parts on short order. And we could have produced much more PPE, and the United States chose not to. But if older people had, for instance, gloves on and truly protective masks, if there were enough, and there haven't been enough for healthcare providers, there haven't been enough in nursing homes in many places, so in really high-risk settings. But if you had that, then it would make it safer. So we have to consider that, yes, there are the viral biologic risks, but there are also ways in which governmental decisions are working against rather than toward people being able to live more full lives like their friends in their 40s, for example.
Okay. Dr. Aronson, we also have a ton of questions on activities, but maybe I should start with this one, which was a question that was submitted early, and I think maybe it has also come up in the chat. Are we all going to be exposed eventually? Should I not venture out during and after the reopening until there's a vaccine? Or as they said, if we're all exposed, should we just sort of, I think the idea of going forward?
Ooh, that's a tough one. Lots of lines of thought. Pretty much every government so far in the World Health Organization have come down not on at least rapid exposure. So this was the thing about flattening the curve. If we all get exposed at the same time, the number of people needing hospital care to get better goes way up and exceeds our capacity to provide it, which means then people die who might have been saved. We saw this happening in Italy. So the idea is maybe in a gradual reopening, more and more people are exposed and we develop a herd immunity at some point as a populace. But that needs to happen gradually for the health system to be able to respond. We don't yet know. There are, for different organisms, there is a different amount of exposure that kind of leaves the population safer. Sometimes you really need everybody to be vaccinated, often with infectious diseases, but sometimes you can protect most people at a lower level, and we don't know. This is much too new. The safest thing will be when we have vaccines that work. Vaccine development has been typically ageist. So I actually saw a trial for which I was too young, so they weren't taking people in their 50s either. The immune system changes with age, but when it comes to, and adults are the people who traditionally have done the research. So they have called everyone else special populations or sort of special cases. But the fact is, if we all live a long life, we're all going to start as children and as elders. And we don't sort of fault children necessarily for their naive immune systems. And I think it's time to stop faulting older people for immune systems that are also different from those of adults. The risk of side effects in older people can be greater. And a fairly famous doctor last week on Twitter noted that, vaccines often don't work so well in older people. But that's because those vaccines are made for younger immune systems. We actually have a pretty impressive science of the aging immune system. And the more we target vaccines to that immune system, the higher the uptake of immunity as a result of those vaccines. And we're just starting to see that in science. But having learned apparently nothing from the last few years, most people working on COVID are really thinking about vaccines for the younger people. And do some younger people die horribly? And it's absolutely a tragedy, without question. And if 8 out of 10 deaths is in older people, it is, ethically sort of hard to excuse not developing vaccines for aging immune systems and trying them out in older adults. There have been enough people, some of you probably heard this thing about let's just sacrifice. It was the governor of Texas saying, Dan Patrick saying, we should just, he's in his 70s, we should sacrifice our lives. That should be an end game move, and we're nowhere near the end game. And we certainly were very beginning of the beginning game when he said that. But are there people who might say, hey, this is another chance for me to do something meaningful with my life and, help humanity. And I'm kind of interested. And yeah, I do that. But we don't ever know if we can get information when the people developing this don't even consider a vaccine for older Americans.
Thank you for that. Really important. So I'm going to go back to activities because we had so many questions from our callers and our people who wrote in ahead with just a tremendous list of activities that they want to know if it's safe. So maybe we can go rapid fire for a few of these that are on people's minds right now. And I'll keep my microphone open so we can go quickly through them. But one that's particularly timely, participating in Black Lives Matter demonstrations, safe or unsafe?
Unsafe, lots of people close together yelling, most of them not wearing masks. There are many ways to participate online, to donate money, to stand outside at a distance, depending on where you live, and show support, to put up signs in your window, all sorts of other things, but lots of bodies in close contact is probably not a good idea.
Okay. How about voting in November by going to the polls? But if you have to go to the polls.
Much better to vote. We have absolutely no idea. Yeah, you want to vote. Voting is good. Please do vote. Vote by mail if you possibly can. If you don't know how to do that, I know the public library helps with that because I heard about that on one of my visits. The post office. There are many ways to learn, and there's lots of time before November.
Oh, we're losing you a bit, but she is recommending voting, but maybe checking with your library or your post office for voting by mail, voting in other ways without going to the polls, which are still potentially may not be safe come this November.
We really this month, really hard to see.
Okay. Let's see, grandparents who are guardians of children who will be returning to school in the fall. I think, that's a really tough question for a lot of people who do rely on their grandparents and in-laws to take care of their children. And should they, think about how they allow them to return to school?
So I'll just say I was missing for a minute there.
Oh.
You guys vanished and then I got you back. So I didn't hear most of that question. Something about children and returning to school. Yeah. Sorry.
For children who are taken care of by their grandparents, mm-hmm. that's the family's source of care for their children, and children needing to return to school. Should people be looking for other options, I guess, is perhaps the question, or is it safe to allow their grandchildren to return to school and come home and still be cared by grandparents?
It's not ideal, but in many families, it's the only feasible reality. So, wow, that's a really tough one. I mean, clearly you want to wash their little hands when they come back and all those good things, but they're not going to wear masks, and they're certainly not going to wear masks at the mealtime, depending on the age of the children. If you have other options, especially early on, as we figure out what's happening, it might be a good idea. But if you can't, I think there's a case to be made, and I haven't really seen this discussed much, but for people in that situation, for the older people to get protective masks for themselves so that they can continue to do their good work with their grandchildren. I think that would be really important. As we've seen, the kids seem to be at very low risk, not none, but very low. And we know the grandparents are at much higher risk. So thinking now and, lobbying the health department for, some PPE for that situation might make sense. Getting it on the radar locally, statewide, and nationally really makes good sense because there's more and more talk about kids going to school. But lots of hand washing, lots of washing down of surfaces, maybe certain areas of the home are open to the child and others are not, like the older adult's bedroom, if there's a separate bedroom, could be an off-bounds area.
Good. Similar to children, just even if you don't live with them, hugging your grandchildren, visiting a newborn, a newborn relative, um, being with family and having that touch and that connection with your family. I think that people are very concerned about that.
Yeah, that's a tough one. I mean, technically, it's not supposed to happen. I have heard lots of stories where it's happening and lots of stories of people heartbroken because it's not happening. Some people are coming with the new grandchild and being outside a window and holding him or her up. I think we all know that that is not close to holding your new grandchild. Given that the hospital and being out and about around so many people is a fairly high risk experience, you might want to at least wait the 14 days until the mother and baby have been home from the hospital to do a visit. Try doing outdoor visits. Again, if we had better protective masks for older people, we could have a little more leeway here. But it's hard to predict when a little tiny being is going to cough and sneeze or something else on top of you. So,
for older adults too, or for perhaps adult children of older adults, there's some questions about, visiting family in an assisted living center, or even moving a parent into a living center at this time, and how to evaluate those risks, and whether any advice you have for that.
yeah, that's a tough one. And what we're seeing in San Francisco is, nursing homes are really highly regulated, and assisted living are a little bit, definitely less tightly. I know the state is going to issue some new guidance in the next week or two because I spoke to them yesterday. A lot of places are doing things like, if there's an open outdoor area where you can all be wearing masks and standing the sort of 6 feet apart, that offers visitation options. Obviously, you couldn't have everybody doing that simultaneously, but there could be schedules or calendars, things like that. I think, we end up trading one public health crisis for another if we keep people so totally isolated for too long. And we're beginning to see that. I'm beginning to hear that from my patients. So I think cautious trade-offs make good sense. In terms of moving people in at the San Francisco level, it's recently been decided that that can be done. They need to be tested before they move in. They need to be quarantined for 14 days, in other words, confined to their room or apartment after they move in. So that may or may not be something somebody wants to do. You also want to be cautious of facilities that had cases. Now, we've heard a lot about bad actor facilities that had many, many, many cases, but there have been others that have had a few. And that's to be expected. So don't consider that a facility that had a bit of COVID, but pretty effectively staunched the spread is a bad place. Obviously ideal if the place you're looking at has had no cases and no illnesses, that would be great. The ones where there have been dozens upon dozens of sick people, they clearly have a staffing and cleanliness issue. So I would steer clear of them.
All right, a lot of questions too are coming in about a variety of retail places, but is it, grocery shopping? And if you are using outside retail establishments, should you be sanitizing your products when you bring them home? Should you be washing all your groceries well, this suggests people in their mid-70s, but I'd say for everybody.
Yeah, we don't know. So what we do know is that the virus can last on a variety of materials, from cardboard boxes to, metal and plastic and things like that, for variable amounts of time, sort of 24 to 72 hours. And then on the Princess cruise ship, there were some places where they found virus, like a week or two later. But there's a difference between the virus is there and the virus makes you sick. But the problem is we don't necessarily know how often things can be transmitted that way. We do know the far more likely transmission is through, breathing, speaking, coughing, yelling, singing, exercising. Also, urine and feces can transmit. So our bodily fluids are clearly a high risk. I would only go to a store or to an open market where everybody was masked and wearing gloves, because that shows that they are doing things to protect your health. This goes similarly for other establishments. You want to see them doing everything possible to protect you. From the sort of erring on the side of caution angle, wiping certain things down. It's not clear that freezing or refrigeration helps, though heat does, to kill the virus. So if you can, wiping things down, and we've been doing it where we have sort of the dirty counter where we put things, and then one of us cleans, and then it goes to the clean counter and it dries off, and then it goes where it belongs, which is a tiresome process, but better safe than sorry if you can manage it. But that doesn't mean like spraying bleach on your broccoli. I just want to be clear about that. Yeah.
Okay, good to know.
Yes.
I just saw this come up today, and I think it was in one of our questions too. What's your opinion about the senior hours for shopping?
So I've had people who love them and people who hate them. My first response when they did that was, well, at least they're doing something. They did it first thing in the day, which as you get older, some people wake up earlier, but also sometimes getting going takes longer. So it seems sort of inconsiderate. Like for our clinics, we tend to try and start geriatrics clinics later than some of the others, just to give people time. So that might not have been so considerate. I've had a patient actually 2 weeks ago said to me, well, then it's just all of us at high risk all there together. On the other hand, if you look at for San Francisco, the city posts daily updates on numbers of infections and numbers of deaths. So while the death rate goes way up in old age, the infection rate is actually among younger people. And older people are being more cautious than younger people. So being surrounded by more cautious people who appear to maybe have less disease might be a good thing. It's considered more good than bad. And then also I've heard from people that sometimes there's just not that many people there. And the fewer the people shopping at any given time, the better.
All right. In your last question about talking about virus transmission reminded our chat monitor that there had been a question about using public restrooms, and certainly the aerosolized situation that happens when you flush. And is that something that people should be concerned about that I feel like we haven't heard about?
Yeah, so there is aerosolization of urine and feces, right? It flies through the air and then it lands in water, and then the water splashes up. And we've all been in public restrooms where you're like, oh my God, so no, avoid them if you possibly can. Yeah, I think that's something to avoid for the time being. If you're having an urgency, what should you do? Well, certainly go before you leave home. Don't drink excessively before you leave home. Maybe if you can find single stalls, that would minimize the spray and damage. You could consider in places where they have the toilet seat covers, spreading a few of them so that, of course, then you're going to increase the risk to the next person because it's going to float out. I might not have a great solution for that. I was trying to be creative, thinking as I went, but at least if you use those, you might minimize the contact area for yourself and potentially for others.
All right. And at the risk of sounding like everybody's next door accounts right now, people who are worried when they want to take long walks, but see many younger people not being masked and bikers not being masked. And is that, what is the true risk of that when you are outdoors, but you see so many people without masks?
You want to steer clear of those people. They have declared that they are not concerned about your safety and health. if you can walk around them, if you can get out of the way, if you can turn your back, all those things, turning your back, maybe that's not the safest idea, but like turn to the side or something. We do know that when people exercise, they're breathing more and there might be an increase in fomites. So that's an issue. So again, just trying to steer clear of those people and hoping the new mask mandate will help for people living in San Francisco, the city. But it's clear in surrounding communities that that is being done less. In some surrounding communities, there isn't much mask wearing at this point.
So speaking of masks too, we have some advice questions coming in. What masks are best? Is a KN95 mask good for an older adult? And gloves, should people be wearing gloves or should they not be wearing gloves because it gives them that false sense of touching everything?
Yeah, such good questions. An N95 is great because it protects the wearer as well as the people around the wearer. There aren't enough of them, and for the most part, we've been asking that they be reserved for the people who are having daily very high risk, so healthcare workers and other caregivers, particularly to sick people. If you happen to have one and haven't donated it, there were big donation campaigns. So some people who had them, I know for fires, no longer have them. And thank you all for your donations. Actually, at UCSF, we had our medical students gather like 15,000 one weekend. It was completely tremendous. Then you can think about surgical masks, or multi-ply masks, meaning they have several layers, can be more helpful. But any cloth covering will help keep you from infecting others. And the more of us who wear them, the less infection there will be out and about. One word of caution, those ones that are advertised everywhere, at least on my feed and various others, with the vent in them, those are good for fires because they help you breathe by filtering out the smoke. But they're bad for COVID-19 because they're filtering coming in, they're not filtering coming out. So you think you're wearing a mask and the people around you think you're wearing a mask to protect them. But in fact, if you're carrying COVID-19, it can go out that little valve. So those are not a good idea. If it's all you have, use something really strong like duct tape to close off that valve if you can, from probably both sides.
Yeah, I was noticing at my grocery store, they were coming around and handing out pieces of tape for people who had those kind of masks and wouldn't
that's
let them in.
fabulous.
Yeah.
I haven't seen much of that. The glove question also raised a good point, which is, yes, gloves keep things off your hands. But we do know that when people wear gloves, they have a false sense of security and they often go from activity to activity thinking I'm safe, but actually they're carrying virus from activity to activity. Whereas if they didn't have the gloves on, they would wash their hands between those activities. I think we all like to think we're going to be the one who remembers to do it just right. Most studies show that most of us will disappoint ourselves in that regard. We'll be wrong. So if having, maybe bring several pairs of gloves and keep asking yourself, or just go with bare hands and something you can use to clean them and just keep cleaning them. You also want to clean your hands, by the way, before you put on the gloves and after you take them off.
A clarifying question about the mask, sorry, to go back to it. KN95, which apparently is different than an N95.
That, I'm sorry, is above my pay grade. I just don't know the answer to that question. I can try and find out I have a colleague who will likely know, and then I can send you an email and maybe you can post it somewhere, but I don't know. Oh, you're muted, Michelle. Oh.
Thank you, Dr. Aronson. We are just hitting 1 o'clock, and I know that our time is short, but I feel like the two of the last things we were going to talk about a little bit were age and mental health. Sort of, attitudes and depression over this, and how we can improve the lives of elders during this time, and also advocacy for more resources. What can we do in those regards as well? So I'm hoping maybe as we wrap up, we could talk about those two issues.
Okay, two really important issues. We've touched on the mental health issue. Ooh, as we begin opening things up, I think thinking of ways you can sort of get outside, see other human beings. This can be done. I mean, I think one of the reasons for the early grocery store hours is that fewer other people are around and about. I'm an early morning person, so it's kind of lovely early. If you can manage it, that will make things safer because you can steer clear of people. You can meet with friends and just walk separate on the street. And what I'm noticing, though, is that sometimes people then don't know what to do when other people social distancing are coming at them on a narrow sidewalk. And I think then you have to decide who's going to go in front and who's going to go in back and sort of have that decided. And we'll get better at reconfiguring ourselves in safe ways. It seems like it's going to be a while before anything returns to normal, if the new normal looks anything like the old normal. So really thinking, I think for each of us to think about what's most important for mental health and physical health, and to understand this is actually almost sort of a metaphor for aging itself, that we can probably still do many things that we enjoy, that give us pleasure and meaning in life, but we almost certainly have to do them differently. And this is true of really as we age generally. So really getting creative, and if you're not feeling creative about that, then brainstorm with some friends over the phone or over a video chat. Maybe the library would even compile some good ideas, or I know we're looking for good ideas on the Division of Geriatrics website at UCSF, or send me ideas for ways that you can be creative and physically active. There are, again, on our website, we have listed a variety of exercises for people, from people who are mostly chair-bound to people who are hugely vigorous, that can be done in times of pandemic. Online things that you can get to read or to visit national parks or to hear music. There are so many options. So I think, if you think about you only want to do it the way you used to do it, then disappointment and sadness will be inevitable. And we just all have to help each other to think, like, what is it about that activity I love? And where else in this current reality might I find that thing I love without doing that specific activity in that way I used to do it? And frankly, this is just good practice for life and aging. Frankly, we've been telling people this for ages. And then getting people to help. I'm popular of the, I really like the grandparent or grandkid challenge, which is, can go either way, obviously, like, here's my homework problem, or here's your challenge for the day. And then, so you speak at the beginning of the day, you speak at the end of the day, and then everybody has to report back what they came up with. So you can have a little friendly competition, you can have some collaboration. It makes it social, but it also solves practical problems. So those are some things. The other part of the question I had on the tip of my tongue, and then I lost it.
I'll bring it up too, but those are great
Okay.
ideas. Thank you. And I think the library too needs to look at ways to help, whether it's pen pals or, virtual volunteering, to get people still active. The last question was really about, and we could go through, there's been a million questions about different advice for different specific businesses that are safe or not. Veterinarians, is it okay to have a plumber in? Things like that. But the last question was about resource advocacy. There was a question about Governor Newsom possibly eliminating adult day health care from the state budget due to funding, which will be devastating to our elders in San Francisco and throughout the state. What can we do if the state continues to cut funds to seniors, or how can we advocate to make sure that seniors and caregivers are protected in the state budget?
Yes, the governor's budget cut all kinds of essential services for older adults, and particularly, the most disadvantaged older adults. This seems sort of crazy in any number of regards, because if they can't get the home services, most will end up in nursing homes. And if they are low income to begin with, those will be public nursing homes, and running public nursing homes is very expensive. It also means that the jobs of the people running all these services will be imperiled. And for adult daycare programs, for example, that often allows the adult children to work in the day. So it harms the economy in any number of ways. The good news is the Senate proposed a budget without those cuts. Those cuts have not gone through, although supposedly they were voting. This was a little sneaky too on the Sunday of Memorial Day weekend. Yeah. So that already tells you it's shameful, I think, or at least suspicious. So you can write Governor Newsom's office. I have done this. There's like a little form online. You can also write all your representatives, your state representatives and senator, and tell them what you think about this. You can join any of the organizations advocating against this, and there are many. You can work for those organizations generally to advocate for older adults. And there are different approaches, from more, aging action ones to more political ones like Gray Panthers, to more justice legal ones like Justice in Aging. But there are so many organizations, all of which could use help and support in this time. And then just keep speaking up. I feel like one of the challenges of aging has been that even older people sometimes believe this notion that, oh, well, you've had more of a life. Well, resources are not zero sum, and there is a huge and growing sort of sector of sort of entrepreneurship for things for older adults. And that's because it doesn't just help older adults, it helps everyone. It creates jobs, it creates creativity and innovation. So stand up for rights. And one of the things I like people to mention is, has PPE gone proportional, been distributed proportional to need and deaths? It has not. If we have another surge, what are we going to do differently? At what point should we be sharing across facilities? Do we need to overhaul our entire nursing home system? Has the fact that the healthcare system has been able to change so quickly in response to this virus shown us that it can change, and that we should, there was a great conversation last week on social media about how hospitals are going broke because what hospitals are mostly paid for are procedures. They're not actually paid to take care of you. So working on health reform so that care is paid for, not just procedures. With care, the idea is you wouldn't need the procedure in the first place. That won't work every time, but it works far more often. It would work far more often if we actually supported care and not just the expensive procedures that happen after we haven't supported it. So stand up, be vocal. This is a great way of passing the time. This is a moment of change, and we can shape that change if we all participate and speak up.
All right, inspiring words, Dr. Aronson. I will bring this session to a close, but any parting thoughts that you didn't get a chance to say or were expecting to be asked about?
No, I think this was pretty comprehensive, and hopefully it activated people. I'm sorry we couldn't get to all the questions. There aren't great answers. There will be increasing guidance in coming weeks, so look out for that. And I hope everybody can find a way to make life feel sort of pleasant and structured and meaningful, while also remaining sort of safe in this new era.
Right. Thank you, Dr. Aronson. And I wanted to add that people who may still want to get in touch with us, want a transcript of some of this, they can email us at volunteer@sfpl.org. If we don't have your information, please get in touch with us. And if Dr. Aronson has an answer to the mask question or anything else she wants, she can share that with us, and we can share that with you. So thank you everyone for joining us here today, this afternoon, for this incredibly informative topic. We'll close out now. Thank you.
Thank you.